Welcome back to Studio 10. A few weeks ago, we introduced you to a woman who had suffered for years from restless leg syndrome until a visit to Mountcastle Vein Center finally gave her relief. Well, Dr. Mountcastle and two more of his patients join us today. Darlene and Vince Leverins are mother and son who both had debilitating problems from their varicose veins and are a true double success story. Welcome.
Hi, how are you?
We're so glad to have all of you. And Dr. Mountcastle, obviously we want to dive right into to Darlene and Vince's stories, but before we do, why don't you give everyone an overview of kind of the philosophy behind Mountcastle Vein Center?
Well, we take care of problems from veins. These are great times to be a vein doctor, Holly. The new laser procedures are painless and very safe and extremely effective, as our guests will attest. The treatments, the old treatments that people are afraid to get are no longer necessary almost all of the time. The vein stripping that everyone remembers an aunt or an uncle or sister having just aren't necessary.
Right.
Nowadays there's no downtime. It's taken care of in an office visit.
And that is so wonderful, because I think that's kind of the deterrent to so many people for getting the problem fixed, is because they know it's going to hurt. And this particular procedure doesn't hurt at all?
No, there's no pain. And we numb the skin and start an IV in the vein, thread a laser fiber into it, close it down, put a Band-Aid on the top.
And so many people, too, I think that varicose veins are a cosmetic problem, but you say there generally is some other reason, health-wise, behind them being there in the first place.
Well, they're from the failure of the valves in the vein. Imagine an upside-down tree with valves in the trunk. When those fail, they're no longer holding the weight of the blood up, and so the branches dilate and become varicose veins inside the leg and on the surface. And the twigs become spider veins. And they're painful. People have aching and tiredness, and therefore Medicare and most insurers see treatment of this painful condition as necessary, medically necessary, and pay for it. And so people don't have to delay treatment for fear of pain, or thinking that it's going to cost them a lot because it's only cosmetic. It's not.
All right. And Darlene, what brought you? You came first. Of you and Vince, you were the first to visit Dr. Mountcastle, correct?
Yes, I went to a seminar, my friend and I went to a seminar because of my son. I wanted to see if he could help him. Well, he looked at me and he took me in, and guess what? I had problems. I said, I'll be the example. So I went, and I'm very happy, very happy. I can do things that I've never been able to do for a long time. Really? Really.
And you didn't even realize that you were missing out?
No. I'm getting older in life. You blame a lot of things on age. So.
When I first saw Darlene, she was kind of gray-faced and shuffling and looked kind of sad. And after her treatment, she came back and said I'd given her a new complexion. I said, Darlene, I didn't do anything for your complexion. She says, look at me. And she did. She looked 10 years younger, and she explained that she... Well, go ahead.
Well, just the color I feel, the circulation is back in my body, and a lot of things.
She said that she used to lay on the couch for 2 weeks thinking about raking the patio off and suffering all the pain from being upright for an hour, and now she just pops up and does it.
And how many people make that mistake where they think it's all just about age?
Lots of people. A lot of men especially. They deny leg pain, and afterwards they say, Doc, it's a miracle. My leg feels so much better. And I say, Bill, I'm looking at your chart. You said no pain several times. I put cosmetic only. I guess I just didn't realize it.
Right. People kind of adapt, I guess, to kind of make it work with their lifestyle.
Exactly.
Yeah. And Vince, you obviously don't have the age issue. You knew you had a problem that your mother obviously wanted to help you out with.
Yeah, I had a bulging varicose vein all through here, and I just ignored it and just went on with life. And one day I went down to the vein center, and then he checked it, and I really didn't even want to have it checked, and I lived with it for a while. But after the procedure, I noticed that my knee's better. I had a bad knee I always dealt with, and I think it's blood circulation, I don't know, but my knee itself is better, and my whole leg's better. And
is this is your leg here, is this correct, Dr. Mountcastle?
That's Vincent's leg before, and that's after. And that picture doesn't tell the story of his pain, though. Vincent would lay on the couch for a couple of days after flying from California. And now the paint's
I'd keep my leg up. I
gone.
went on a lot of flights, and I noticed a lot of, I don't know if it was related to the flying, but I had my leg up for a few days.
And I'm sure that probably that doesn't help to be seated for long periods of time. Is that your job lends itself to having to fly a lot?
It can.
Mm-hmm.
It can.
Okay.
Vincent was afraid of doctors and needles and anything medical. So
this must have been nice then to know that you're really going to deal with something that's particularly pain-free versus the old procedures that you would have to deal with a lot of pain.
A lot nicer. And he's a good man, and I felt comfortable around him.
And speaking of being a good man, you really enjoy what you do. I think we really only got to touch on that a tiny bit when you were here last time, but you're so proud of your job, and I think that's so wonderful.
thank you. I do. I feel so lucky. The patients are always happy, and the results are wonderful. It's a great time to be a vein doctor.
And speaking of great times for things, you're actually going to be offering some seminars for people to come out if they want to learn more about the possibility of taking your procedure.
We have a kind of an informal luncheon seminar. Please call our office to RSVP. We'll have a session at the Plaza de Oro on South 19, across from Walmart on the 23rd, and also a luncheon at the Isla del Sol Yacht and Country Club on the 31st.
Okay. And in addition to that, well, obviously the phone number is there for people to call, and they can find that on our website as well. But in addition, you're actually offering a free visit?
We offer a free educational first visit to anyone who would like to come to our office. We show a brief DVD, about 10 minutes, and then sit with the patients and answer their questions about their vein problems.
Okay. Well,
so it's easy.
Very simple, very easy, and free.
Yep.
And thank you so much. We've run out of time. Darlene and Vince, thank you so much for being with us. I'm so glad that you both are doing so well. It's wonderful. And obviously, Dr. Mountcastle, thank you for being here as well.
Thank you.